Hello, guys. This is your lecture for multiple sclerosis. MS is a chronic neurologic disorder, and this thing affects. It is an autoimmune disorder affecting, of course, the myelin sheath only. This will cause demyelination of the axon. Your nerves. Of course, if you remember from A and P, the myelin sheath is like a um, smooth covering, like a wire, like an electric wire that covers the the neuron, the nerve. Um, we need the myelin sheath in order for electrical signals, specifically along the skeletal muscles, for those signals to travel smoothly. Now, if there is demyelination, such as what happens in the illustration here, so the myelin sheath is necessary for the impulses to travel from one neuron to the next. If you have MS, it will not only cause the signals to be slowed, therefore the muscle movement will be interrupted, therefore resulting in uncoordinated muscle movements and tremors, for instance. That will also weaken, of course, the neuron, and then they will become severed, like this illustration here, and this will manifest in the patient's symptoms over time. As already mentioned, the um, the disease is chronic and it is an autoimmune disease. The sad thing about this is it affects young people between 22 or as our middle-aged people are also affected. Um, there are many types, but we will only test this number one because this is the most common form. We'll only discuss the relapsing remitting type. Now, because it's chronic, of course, you won't have um, problems every day of your life. Okay, just like COPD, for instance, or lupus, you'll have good days and bad days. This type affects younger people. Okay, this will affect 20 to 30-year-olds, and then of course they'll grow older with the disease because it's chronic, so they die with the disease. Um, the onset can be, I mean, the relapses, which are the exacerbations or flare-ups, um, are exacerbated usually or triggered by stress, which can be anything. And as you know, 20 to 30-year-olds, these are childbearing age, and because the disease affects more women than men, and you can understand the resulting complications will also include depression. Okay, so these are your nursing interventions. No, sorry, skip that. I don't know why they put that in there. um, Manifestations of MS, they are here. They listed them here. You can also look at it in the illustration down here, right? So if you imagine you are between 20 and 30 years old, and you are already manifesting these, of course nobody will be happy like this. um, and this is why I mean, you start developing depression, and most patients will end up being bedbound, homebound, so they cannot work anymore. Eventually the depression will lead to well, it will exacerbate the immobility, and they'll start having weight gain, and that will trigger other complications related to the disease. For diagnosis, just like lupus, this thing has no specific tests in order to diagnose MS. If you read the whole paragraph, these other tests here are not going to diagnose MS, but rather they are used to help rule out other causes, meaning it the tests are done more to eliminate other causes, thereby leaving MS as your only uh, medical diagnosis, if that makes sense. Treatment. Let me emphasize that there is no cure for this. It is an autoimmune disorder, so therefore there are no cures for any autoimmune disease. So the patient will deal with this for the rest of their life. The goal of treatment, of course, are the following. We improve the speed of recovery from attacks. Those are the flare-ups. Again, the flare-ups are triggered by stress, which can be anything, can be physical, psychological, or emotional stress. Pregnancy can also be a trigger. As with any other autoimmune disease, this will be managed with immunosuppressants and steroids, which are in a table below. Um, to reduce stress, of course, we have non-pharmacologic interventions here, which is lifestyle management, just staying healthy, rest, exercise, eat healthy, um, along with the medications. Now, this, as well as with any other autoimmune disease, they will be a cocktail of immunosuppressants. Please take note that the steroids here and plasmapheresis are only done during a flare up, meaning they are not done routinely. So, also to avoid chronic complications related to steroids, such as we already discussed Cushing syndrome, because that's the result of lifelong corticosteroid treatment. So the patient will instead receive from a day to day, in order to decrease the number of flare ups. They will have these disease modifying immunomodulators such as beta interferons, glatiramer, fingolimod, all of which are listed in a table, like I said below. Other treatments, such as from here on down, are more symptomatic treatment. They do not alter the course of the disease, but they are helpful for the other manifestations of the disorder. As you can see here on the signs and symptoms, so the patient will need some relief from the tremors. These tremors here can be treated with antispasmodics, muscle relaxants. They need something for pain also. And this is a drug table or chart. The testable part is, of course, the nursing interventions. Although this one here, this third column, did not mention nursing interventions. The questions on the exam, of course, will be implied, because as you can see, the mechanism of action is going to, the drug will reduce the body's ability to make antibodies, for instance. So therefore, what will be the um, consequences of that drug action? Of course, that will make the patient at risk for infections. Take note though that these immunomodulators, such as interferon, either beta 1A or beta 1B, glatiramer or copaxone, these are all injectables. These are subcutaneous injections. So is natalizumab. This is also injectable. Fingolimod is the only oral immunomodulator. The other drugs on this table, baclofen is a common muscle relaxant. The others, this one, for instance, you've seen this probably in a previous semester. Oxybutynin or ditropan is for overactive bladder, because these patients do have bladder and bowel incontinence. Okay, imagine you're 20 to 30 years old, and you already have bladder leaking. Okay, so these drugs here are all related to the symptoms that result from the disorder, but again, do not alter the course of the disease, but they do help manage the resulting complications. The same thing for these patients may develop seizures, so they'll be put on um, anti-seizure medications. And like I already said, prednisone, this is used only for periods of exacerbation. And as already mentioned earlier, if needed, the patient will have to undergo plasmapheresis. All right, so over time, the patient, imagine you've had MS since you were 20 or 30 years old, then you grow older, um, without enough support system, for instance. Anyone can easily succumb to this disorder, because these are the common complications that will result. As I already mentioned, this can ruin relationships. Okay, not to mention the patient's self-esteem. They develop depression, and it doesn't stop there. Once, like I mentioned earlier, once they get bedridden, homebound, other complications of immobility will result in skin breakdown. Plus, the bowel and bladder incontinence won't help. So that will exacerbate the skin breakdown. They'll have frequent falls, and like I already mentioned, the depression um, will be one of the complications that really wouldn't help the situation. Here's a summary for nursing management. These are again our patient's signs and symptoms, and here are our nursing actions. And here are our teachings, which again we didn't mention specific side effects resulting from the drugs, but generally immunosuppressants, immunomodulators, including steroids during periods of exacerbation, of course, will put the patient at risk for infections. So our goal is, of course, to make this patient as comfortable as possible, um, help them lead, as normal lives as possible for as long as possible. It's all a balancing act of taking the maintenance medications, seeking help during exacerbations, at which times again they will be put on steroids and or plasmapheresis.